Hello, I'm Dr. Mark Jones, a podiatrist with NorthShore Health Centers, and you're watching Ask the Expert. People often ask me, what is a podiatrist? I like to tell my patients it's a mix between orthopedics and dermatology, but we're focused on the foot and ankle. In our line of work, we focus on anything from pediatrics to the elderly, from deformity to basic injuries and even skin conditions. Oftentimes patients come in who are diabetic and we do limb salvage, we do diabetic foot screenings. Let's take a look at how complex the foot is. 28 bones, 33 joints. There's a lot of moving parts in this foot. If we look at the amount of pressure that the foot takes, we notice that we're seeing more patients that come in and putting extreme pressure on this foot, whether it's a workload injury, whether it's overuse injuries, or whether it's simply just day-to-day foot and ankle pain. We treat all aspects of foot and ankle care. Let's take a look at certain conditions that we treat. Of course, a podiatrist treats skin, nails, things like warts, ingrown toenails, any type of skin condition, athlete's foot, for example. A lot of these things, believe it or not, can become disabling. Oftentimes, people come in just for the cosmetic appearance of their foot. Our goal is to look at all foot conditions independently, to evaluate the patient's social factors with their healthcare, to evaluate their work factors with their healthcare, to evaluate their activity level and what their desires and goals are to get back to a normal pain-free life. What other conditions do we treat at NorthShore? Let's take a look at common foot and ankle conditions. From heel pain to bunions and hammer toes, those are all things that we can alleviate oftentimes without surgery. But if surgery is ever required, we will go into a detailed protocol, a detailed explanation, and a detailed surgical plan to alleviate those conditions and get you back on your feet quickly. Let's take a look at some of the pediatric deformities that we treat. Whether it's what's called breaking metatarsia, here's an example. Sometimes we put on little mini external fixators to lengthen out a foot if someone has a congenital foot deformity. We also look at pediatric deformity from a flat foot position, whether it's an orthotic, arch support, change of shoe gear, or even surgical correction of flat foot in children and adults. Those are all conditions we handle here at NorthShore. When it comes to injuries, sports injuries, we see a lot of weekend warriors, even professional athletes. Achilles tendon ruptures, posterior tibial tendon issues, flat foot associated, and a lot of ankle fractures. We're on trauma call at regional hospitals, and we see anything from that complex work injury to a sports injury such as ankle fractures and tendon ruptures. All right, let's take a look at a few things here. This is an external fixator for an ankle fracture, minimal incision approach to be able to stabilize without an aggressive open approach. Those can be used in many different foot and ankle conditions. This is a simple ankle brace. Oftentimes when you're seeing a podiatrist, a foot and ankle surgeon, you're left without a brace long term. I'm an advocate of supporting post, meaning someone has surgery from me, oftentimes we get you back to full function. But if you're gonna go on a hiking vacation, if you're an active athlete, you'd like to play tennis, any other sports, I like to make sure that we have an AFO or an ankle foot orthotic, a professional grade device to get you back for extra security, get you back to your activities pain-free. One of the most common things that we prescribe is a foot orthotics, and there are many different styles of orthotics. Not all orthotics are cut from the same cloth, so to speak. If you need an orthotic such as a UCB, a University of California, Berkeley design, if you need an orthotic for a dress shoe, a certain type of work boot, all those things are specifically tailored, custom to the patient. These are all custom-made devices at NorthShore. Here at NorthShore, we focus on getting patients back to active lifestyles, relieving their discomfort. Chronic foot pain is not normal and it's treatable. If you do suffer from chronic foot pain, or you're concerned about developing a debilitating condition, or you're just not able to enjoy your life, come into our clinic. Make a visit. We'll go through your care specifically tailored to you. For more information, visit northshorehealth.org.